Ladies and gents, welcome back. Our medical system in Canada is failing us. We're faring the worst out of all the first world countries with universal healthcare. One thing that sets us aside is the fact that we have no private option in Canada, as other places do at least have private options. I guess our private option is to go to the United States of America, which is controversial and people are not encouraged to do so, and may be very costly actually in the long run. Over 3 million Canadians on healthcare waiting list, says True North News. Over 3 million Canadians are stuck on a waiting list for surgery, a diagnostic scan, or to see a specialist, with some estimates pushing the total close to 4 million, according to new data from a Canadian think tank. A Second Street study has found that nearly 3.2 million people are on these wait lists across the provincial and territorial healthcare systems. Now, this is a lot of people waiting for healthcare, waiting for scans, and a lot of people, by the time they get these scans, they're looking for checkups to find out if what they have is a bad illness. Maybe it could be cancer screenings, things like that. By the time they get these screenings, it may be too late for a number of these people. But these aren't the only situations that we're having in Canada. We have a giant economic downturn. And right now, Conservative leader warns of a slippery slope after Mississauga food bank users seek MAID. What is MAID? MAID is a fancy, nice, politically correct term for euthanasia. This is a program that we have in Canada that was brought about to... The initial idea of MAID was to help people that were suffering and terminal, but it's now being suggested and offered to people outside of that purview. Conservative leader Pierre Poilievre is warning of a slippery slope regarding Canada's medical assistance in dying laws, saying it would not be provided to people who have mental illness as their sole condition. His comments coming after people reached out to the Mississauga Food Bank seeking MAID. These are people that are just looking for help. They're having a hard time struggling through life, and well, they're seeking out euthanasia as an option to get out of it. Here's Pierre Poilievre in his words.
Conservatives do not believe that medical assistance in dying is a solution for mental illness. Conservatives believe that we should provide mental health care to people to improve their quality of life, help heal the psychological wounds that are afflicting them, rather than giving up. And we're very worried about the slippery slope that we see. We see now cases where, certain groups are advocating that small infants be given medical assistance in dying. Obviously, they could not consent to that. We see our Veterans Department telling our heroes that instead of getting the services that they deserve, they should consider ending their own lives. We have the CEO of the Mississauga Food Bank saying that she has people coming into her facility asking not for food, but for help ending their lives, not because they're sick, but because they can't afford to eat. And I believe that we've gone down a slippery slope, and this has been extended far beyond its original purpose. My belief is that we should try to give people lives that they believe are worth living, rather than telling them to give up on life altogether. Life is a precious thing, and government should work with people to give them a life worth living rather than telling them to give up.
This isn't Pierre Poilievre being the only one to voice their opinion about this. Forbs wrote an article a while back saying Canada's new euthanasia laws carrying upsetting Nazi-era echoes, warns expert. Canada's extremely liberal euthanasia laws, which next year are set to be extended to include people suffering from mental health conditions and potentially minors. Now, what they're getting into on this, and the article doesn't get too deep into it, but they're actually, because of the COVID-19 vaccination and people's hesitancy towards getting vaccinated, and parents not giving consent for their children, and the push to indoctrinate children and have them want to get the vaccines, They opened up the door to this concept of mature minors, like minors that they consider to be mature enough to make their own medical decisions. Now, there are always repercussions for there's consequences for these actions. When you put something forward, you don't see the unintended consequences. And when they're pushing for medical assistance in dying for virtually any reason that somebody might want, and don't get me wrong here, they're going after people with mental illnesses, and we all know that depression is a mental illness, and we're supposed to be protecting people with depression. Now, when you introduce that to people who are 12 years old, as young as 12 years old, considering them mature minors, that they can make their own medical decisions without their parental consent, it becomes a very scary thing. So yeah, this is extended to include people suffering from mental health and conditions, and potentially minors have been slammed for being reminiscent of the way the Nazis dealt with people with disabilities by a leading academic in the field. In an article published by the Associated Press, which we'll get to last week, Tim Stanton, director of the Canadian Institute for Inclusion and Citizenship at the University of British Columbia, said the country's uniquely permissive euthanasia laws were probably the biggest existential threat to disabled people since the Nazis' program in Germany in the 1930s. The AP article additionally detailed the story of 61-year-old Alan Nichols. Well, let's get into that. So, disturbing, experts troubled by Canadian euthanasia laws. This is the story of Alan Nichols. He had a history of depression and other medical issues, but none were life-threatening. When 61-year-old Canadian was hospitalized in June 2019 over fears he might be suicidal, he asked his brother to bust him out as soon as possible. Within a month, Nichols submitted a request to be euthanized and was killed despite concerns raised by his family and a nurse practitioner. His application for euthanasia listed only one health condition as the reason for his request to die: hearing loss. Nichols' family reported the case to the police and health authorities, arguing that he lacked the capacity to understand the process and was not suffering unbearably. Among the requirements for euthanasia, they said he was not taking needed medication, wasn't using the cochlear implant that helped him hear, and that hospital staffers improperly helped him request euthanasia. Only God will know after this whole scenario what the truth of the situation was. Alan was basically put to death, his brother Gary Nichols said. Disability experts say the story is not unique in Canada, which arguably has the world's most permissive euthanasia rules, allowing people with serious disabilities to choose to be killed in absence of any other medical issue. Many Canadians support euthanasia, and the advocacy group Dying with Dignity says the procedure is driven by compassion, an end to suffering and discrimination, and desire for personal autonomy. But human rights advocates say that the country's regulations lack necessary safeguards to value the lives of disabled people and are prompting doctors and health workers to suggest the procedure to those who may not otherwise consider it. And it's also been offered to our nation's veterans through the VA. There's been several reported cases of the VA offering medical assistance in dying as an option to get out of this. Now, tonight I have a premiere podcast coming out with Annabel. I always mispronounce this. It's not Purcell, it's Purcell. Annabel Purcell. She'll be on the show tonight, and that is the premiere podcast at 9 Eastern time, after which the video will be up. It's a 3-hour conversation with Annabel, and she got her attention on the internet via TikTok, putting that out there and talking about MAID, her disabilities, and what she's going through in Canada, and how essentially the Canadian government is incentivizing her to end it all instead of going on to fight. And she's been fighting a long time, since the age of 5 years old, after suffering a stroke. Check out the podcast tonight, And also, she's going to be going to Ottawa. She's on a one-person crusade to fight against the government and their push for this. Also, fighting for a bill that's been tabled, sitting on the desks of Parliament, that would help fund disabled people. They've been sitting on it for 6 years. So she's going there to raise bring attention to that. She also has a Give, Send, Go. I'll leave a link in the description down below where she has a conversation with me on the Give, Send, Go. But she's doing her campaign to go there, trying to raise some funds so she doesn't sit there frozen on the street as she's doing so. So please consider going to that. Here's an op-ed from Canada's True North. Again, links in the description down below. Canada's MAID approach sends a dangerous message. And I would encourage all of you to go read this op-ed for the sake of keeping this brief. I'm not going to go through much of it. This year, I'm horrified to realize that some Canadians are now wondering whether they should include suicide in their plans. I'll leave the link to this article. It's a really good op-ed about this situation with euthanasia, with the politically correct name they're using, MAID. It sounds really nice. The acronym should be MAD, because normally you don't use the in an acronym, medical assistance in dying. You would just use the MAD. I think that's a better acronym for it entirely. Anyway, leave a comment in the comment section down below. Let me know what you think of this whole situation. With the mad push to save money, it appears, on the side of the government when it comes to health care, in people vying for this new euthanasia program. Let me know in the comments down below, and we'll see you in the next one. Keep on trucking.